Dr. Tammy Benton is the psychiatrist in chief, executive director, and chair of the Department of Child and Adolescent Psychiatry and Behavioral Sciences at the Children's Hospital of Philadelphia. She's alarmed and believes that the state of our children's mental health is best described as a crisis. Dr. Benton, thank you so much for being here. I really appreciate your time and expertise.
Thank you for asking me to join you this morning.
Were you of that opinion that we've reached crisis proportion before COVID, or is this a post-COVID phenomenon?
So certainly we were struggling prior to COVID, and there were definitely periods where we had a significant crisis in access to mental health services in Philadelphia. So back in 2015 or 16, when the Einstein Crisis Center closed, the emergency services for all adolescents were unavailable around that time. And at that time, we had started to use our emergency department at the Children's Hospital, which is not a psychiatric emergency department, to meet the needs of most young people in the city. We were able to get past that in 2016 and 17 when Belmont opened their crisis response center, and we dedicated more resources to providing emergency care at CHOP. But we were struggling even then. And even before the pandemic, the average wait time for appointments was about 50 days for outpatient appointments. And so we were really struggling prior to the pandemic. Once the pandemic hit and resources became contracted, we really struggled to meet the needs of patients. And now, post-pandemic, what we're seeing is large numbers of young people and their families seeking services.
Do you think this is a Philly-only story, or do you think what you're experiencing at Children's Hospital of Philadelphia is taking place all across the country?
Oh, absolutely. So this is a national problem. So just a few months ago, Colorado Children's Hospital declared a state of emergency in Colorado due to the limited access to services and the mounting mental health needs. So for the state of Colorado, the leading cause of death for young people between the ages of 10 to 19 is suicide. And that they're attributing that to an increase in the level of distress and just not enough mental health providers. What we're experiencing is being experienced across the entire United States. And so this is not a Philadelphia problem. In some ways, we actually have more resources and do better than many other states. The state of Colorado has 15 child and adolescent psychiatrists per 100,000 children. We have 25 child and adolescent psychiatrists per 100,000 children. Still not enough, but it reflects for you some of the challenges to meeting the need.
I've seen some of the nationwide data, and it backs up what you're saying. Nationwide, hospitals saw in a 7-month span in 2020 a 24% increase over the same period in the year before in emergency visits due to mental health conditions among 5 to 11-year-olds, and a 31% increase among patients 12 to 17. And what concerns me, among other things, Dr. Benton, is those are the kids and teens who are presenting. And as I think you'll probably explain to my audience, we also have to worry about those who aren't getting any formal care.
So, and we don't have any idea of what those numbers are. And so one of the things we learned during the pandemic, when we all rapidly transitioned to video visits, is that there were large numbers of families who had no access to broadband. So they were not even available to access telehealth services. And telehealth has been one of the amazing advances that has occurred during this pandemic that's allowed us to reach more people. We did notice within our own institution that during the pandemic, for young people coming into the emergency department for care, there was a slight shift in our payer mix, and the utilization of Medicaid for those who receive Medicaid because of their income level is often used as a proxy for income. Okay. And essentially, what we were finding is that fewer people with Medicaid insurance were actually coming to the emergency department. And what we were seeing was an increased number of those with private insurance, which suggests perhaps that what's happening is that those who actually don't have the funds could not access services. That's a trend that we're observing across the United States.
Why are the payment issues? I'm not quite sure how to ask this question. I'll do my best. But why are the payment issues still such an issue, a problem. The reimbursements is what I'm really talking about. In other words, it's just not the same as having a physical injury. Despite all the national conversation about the need to address mental health, particularly in younger Americans, it still seems as if a number of providers are out of reach for a patient because they don't accept insurance.
And you've identified a major barrier to access to care. So the majority of psychiatrists in the United States are not accepting insurance. It's a huge problem, and same for the therapists. The reimbursement issues are longstanding, and despite parity, we haven't actually addressed the issue around good reimbursement for mental health care. And you're correct, it's so much less than our medical services. And then in addition to that, the insurance system is very fragmented. So for families, it's hard to get access. So even if you have resources, you know, you may call a psychiatrist or a psychologist, the phone numbers aren't correct. They're not taking new patients. They're not in your network. And part of that relates to the fact that there just has not been a focus on adequate reimbursement and integration of mental health services. It had not been a priority. I'm happy to say that, you know, over the last year to 2 years, we've seen increased federal focus on this issue, and there seems to be strong bipartisan support for some of the measures that have been recommended to address some of these problems. And so many may not know that probably a third of young people receive their mental health services through their local schools. And schools provide quite a few mental health services for kids who are not having significant mental health problems. And they provide as much care as subspecialty mental health providers like psychologists and psychiatrists. Many kids are starting to receive their care in the primary care setting, where we're establishing integrated care or collaborative care models where there are therapists in those primary care practices. So there's an increased focus on being able to expand how care is provided. But one of the barriers has been reimbursement historically, and there's increased national focus on addressing that. So one of the reasons that we're struggling with this crisis that we have right now specifically relates to those things you've just mentioned. The payer issues has made it very, very difficult for organizations to survive financially with the current state of reimbursement.
I also think, Dr. Benton, that we've not fully addressed and solved the stigma issue. And that if you had a child who had a sprained ankle, immediately you're headed to a primary care physician or to the ER. But if it's a mental health issue, maybe there's still going to be some reluctance to get the treatment that your child requires.
That is absolutely true. And I'm happy to say I think we're making some progress in that area, because I'm finding that this younger generation are much more open to embracing whole health. And they recognize that there is no health without mental health. And so they're able to talk to people, talk to their families, talk to their clinicians. We're actually recommending for families, because of some of the issues you just raised around stigma, that if they find themselves in situations where they're concerned about their young person's mental health, they should actually reach out to their primary care provider. Your primary care provider may be able to help you with whatever is happening, particularly the milder cases of illness such as anxiety or depression that's not severe, or even for young people who might be saying, I've felt suicidal. Your primary care provider can be the gateway to accessing services. So they can help you with some of those problems. They can treat some of those problems. They can connect you with a network of clinicians who may be able to help you with those issues. But we found primary care really helps people with the stigma related to mental health.
I buried the lead. What is it about the pandemic that has made it more difficult for our youth? I assume, among other things, you'll tell me it's the lack of socialization because they've not been in school with one another. What else?
It's been the lockdowns. And the social isolation is a major factor for young people. It's been anxiety and fear, uncertainty about the future, family stress, loss of relatives. You know, for some young people, they've never lost a relative until COVID. And it wasn't a normal process. It wasn't that a relative became sick and you were able to prepare for loss. For some kids, their relative went off to the hospital. They never saw them again. There's the loss of milestones, things they looked forward to. For many young people, there was no longer anything to look forward to. They didn't know what was going to happen. So all of those things were very stressful for families and for children and adolescents. But we also know that prolonged stress and chronic stress leads to toxic stress. And toxic stress contributes to the onset of several mental health symptoms. And so the stress of the pandemic and all those things we just talked about, the lockdowns, the social isolation, uncertainty about the future, for young people who were not struggling at all, these became problems. We started to see young people who had never had any significant mental health challenges prior to the pandemic who were presenting to our emergency department with pretty significant concerns. And for those who were struggling prior to the pandemic, it was even worse because they lost their services and they lost all the other supports. The other major thing for young people that I appreciate now more than I ever did was the buffering supports that are available in the community. So your teachers, your schools are more than just the places your kids go to get their education. It's also where they go to get support from not just their peers, but other caring adults. And so all of those things were lost during the pandemic. And those are some of the factors. I'm sorry.
No. Yeah, this is excellent, and I appreciate everything you've told us so far. What's the call to action? What is it that we should all be doing?
So we should all be supporting mental health more. We should all be talking to our payers and our insurance companies about the need to provide the resources that we need to be able to access the services. And we should also be supporting our schools and our communities in opening up the conversation about mental health to decrease the stigma. On an action level, there's several legislative actions now in Congress related to mental health. And those legislative actions focus on is increasing the number of mental health providers that are available across specialties, across psychiatry, psychology, social work, identifying resources to support others like community workers and peer counselors. So we in mental health, I think, have not fully maximized on the capacity for other parents and families to help parents and families navigate these complex systems. So reimbursement to support those professionals would help. Loan repayment would help, because one of the factors is, physicians are graduating with huge amounts of debt and can't afford to work in areas that are underserved and can't afford to even work in mental health. Fortunately, we are seeing increasing numbers of people who are interested, but we don't want them to disappear into the masses of people who are only accepting cash for service and not accepting insurance. We're asking for support for expanded mental health care in schools and in primary care practices. And then we're asking for continued support for telehealth. So, one of the challenges to utilization of telehealth has been billing. The other has been being able to work across state lines to expand access. So for example, we have lots of providers at the Children's Hospital compared with some other jurisdictions or other areas, but we were able to reach Allentown and other far-reaching places without families having to drive into the city via telehealth.
I have a final question for you. It may sound like an odd question, maybe because it is an odd question. I don't know, but it's my peanut allergy question. When I was young, when I was growing up, I didn't know kids with peanut allergies. Were they among us and we didn't know it, and now we're equipped to deal with them? And similarly, with regard to mental health, have things, how do I say this, gotten worse? Have these problems become more progressive? Or is it they were with us all along and we really just never knew and didn't respond?
They've been with us all along. And because of shame and stigma, I think we just didn't acknowledge it. And that's unfortunate because we have treatments that work. So we always have had children who struggle with anxiety and depression and impulse control disorders. They've always been there, but people just didn't get the support that they needed. And unfortunately, for many young adults or adults now, they'll tell you their problems started when they were younger. And if we'd intervened earlier, they'd be doing better now. I do believe some things have gotten worse. So we know that the rates of depression for adolescents has been increasing for some time. And much of that is related to many things that are happening in the environment. Social media can be a contributor.
Technology?
Technologies, social stress, academic demands, all of those things contribute to increased stress and anxiety for young people. So it was always there, but we have some indication that it's gotten worse lately. And about 2/3 of young people will experience some sort of mental health challenge during their lifetimes. And so they've been there for a while, and we just didn't recognize it.
Dr. Benton, that was excellent. Thank you so much. I really appreciate your having been here.